Ohio Governor Mike DeWine has announced the first steps to reopening the state, starting with elective surgeries. With more on where we stand this morning, we are joined by Dr. Keith Armitage with University Hospitals. Doctor, first of all, thank you for joining us once again. Appreciate you taking out time out of your busy day to join us. Let's talk about the good news, and it seems that we are indeed flattening the curve. 342 new cases in the last 24 hours, but we can't get too comfortable.
You're exactly right, Wayne. We're very lucky in Ohio that for a variety of reasons, and probably a lot has to do with the early action by our governor, health director, we didn't see the big surge that we've seen. You know, compare us to Detroit, 20 times more cases in Detroit than Cleveland, which is really, really stunning. But, you know, we're still vulnerable, and I think the governor and health director will open up the economy slowly, carefully, do testing. You know, we'll probably continue to see cases for months. We just don't want to see a surge where there's a lot of critical patients that come into the hospital all at once.
With that in mind, doctor, when we begin to open up the economy gradually, as what the governor is saying, what does that look like from a medical point of view as far as you're concerned?
Well, I think just from a public health point of view, people need to still continue to do social distancing, wear a mask. I think from a medical point, you know, at the state level, I think they want to do as many tests as they can to get an idea if we're starting to see an escalation. The thing about this virus is if there's no social distancing, it increases exponentially. And as they relax some of the work rules and people need to go back to work, there's no question, they need to monitor this and to see if the sort of the intermediate mitigation that we can do will keep it from spreading exponentially. I think medically, the hospitals in Northeast Ohio will continue to see cases until we have a vaccine. The real question for us is, will we see a big surge, a second surge?
Yeah.
You know, we're all prepared for a big surge, and we hope it doesn't happen.
They're talking about the big surge later on this year, which would be absolutely horrible, but hopefully we'll be prepared for it. And as a matter of fact, how do you prepare? How do we prepare for a second surge?
Yeah, I think well, all the preparation we made for the first surge that didn't happen, you know, those plans are continuing to be refined. I know all the big hospitals and all the you know other hospitals in our region were prepared for 3 times as many patients, right. A lot of critical patients. So the plans are in place, the facilities, and so those plans will continue. And I think each you know, our hospital will continue to have tabletop exercises where we get together and we say, okay, let's say we get a surge, you know, nursing, doctors, respiratory therapists, ventilators, you know, how does this all work out? I think we'll continue to do that and prepare until we have a vaccine and we're more comfortable we're not going to have a surge. I think that and one of the things that's been discussed is influenza. You know, when we have a bad flu season in Cleveland, the healthcare capacity in our region gets taxed. You know, the hospitals get full, the ERs get full. Yeah. And I think that's what, you know, Dr. Redfield was talking about. What if we had a bad flu season and a coronavirus surge? That could be really interesting. So, of course, everyone should get a flu shot.
Doctor, have to let you go, but real quickly, there's a new study that came out, a major U.S. study saying that the virus has different effects on different people. Is that what you're seeing?
Yeah, I mean, there's a lot of factors that go into that. You know, some have to do with comorbid conditions and genetic factors, and there's a lot of interesting study going on.
Dr. Keith Armitage from University Hospitals, thank you once again for your information this morning.
Very welcome.